I think we're live now, so good afternoon, everybody. Welcome to this Health Foundation webinar on the very vexed question of can politicians get social care done? My name is Jennifer Dixon and I'm delighted to be your chair here today. So, social care. The Prime Minister stood on the steps of Downing Street, didn't he, in the summer of 2019 and pledged, quote, to fix social care once and for all. But as we all know, the government is yet to outline proposals for England, and the Queen's speech simply said that proposals will be brought forwards. The repeated failure to fix social care at all over many decades is a quote, stain on our nation, and quote, extremely disappointing, and quote, that's probably an understatement, according to Andrew Dilnot. Norman Warner put it more fruitily. He called it a chronic failure of the political class. There are no shortage of solutions, in fact, from the state ensuring to cover catastrophic costs to a fully blown tax-funded national care service with generous coverage and benefit package. The block to change appears to be much more to do with political will, courage, and leadership. You can see the risks, the costs, who benefits, who pays, how to sell reform to voters. Remember the 2017 election dementia tax and the death tax before that in 2010. And tapping housing wealth to pay for more generous state-funded social care, it's a hotter button than Brexit in most parts of the country. Insiders tell us that this time it isn't Groundhog Day, it's serious. Reform is on the cards, they say. It's just delayed until later on this year. Well, is it? What's the real holdup? What will it take for the political class to act? And is this really the year that the Prime Minister will make good his promise? So to help us answer these questions, I'm truly delighted to welcome our expert panel today. We have Liz Kendall MP, who's the Shadow Minister for Social Care. Liz has been Labour MP for Leicester West since 2010. Since 2020, she served as Shadow Minister for Social Care, having previously held the role of Shadow Minister for Care and Older People from 2011 to 2015. We also want to welcome Damian Green MP, who's the co-chair of the All-Party Parliamentary Group on Adult Social Care. Damian was elected in 1997 as MP for Ashford, and from 2012 to 14, he was Minister of State for Policing, Criminal Justice and Victims, and in 2016 became Secretary of State for Work and Pensions. He was first Secretary of State and Minister for the Cabinet Office from June to December 2017. And Damian also serves on the Digital, Culture, Media and Sport Select Committees and is also the chair of the APPG for Longevity. And third, we have Sarah Neville, who's the Global Health Editor of the Financial Times. Sarah has been with the paper for 20 years. Well done, Sarah, that's great. She's been working in senior editing and reporting positions, including Weekend News Editor, Analysis Editor, UK News Editor, Public Policy Editor, and Global Pharmaceuticals Editor. Welcome, Sarah. And then last but not least, our very own Charles Tallack, who's Assistant Director of the Real Centre here at the Health Foundation. Before joining us, Charles was the Head of Operational Research and Evaluation at NHS England. And before that, Charles was a career civil servant with stints at the Department of Health, the Prime Minister's Strategy Unit, and indeed the Treasury. From 2010 to 11, he was Chief Analyst to the Dilnot Commission, before then heading a team at the Department of Health working on reform of social care. So welcome all of you. And before we start, there's just a few housekeeping bits as usual. First thing to say is that the event is being recorded and the video will be available on our website afterwards within 24 hours. So please tell your friends. And we'll be taking questions from you, the audience, for the last part of this seminar. So please use the Q&A box at the bottom of your screen to submit questions. And if you like someone else's question, just click on the thumbs up icon in the question in the Q&A function, and we'll try and answer all the most popular questions. And thanks to those of you who've already submitted questions, and I'm going to try and get to as many of these as possible. And lastly, for anyone wishing to tweet, today's hashtag is hashtag THF, that's the Health Foundation, THF, Get Care Done. So without more ado, let's start with Charles, who's going to help us by outlining some background facts and figures on the vexed issue of social care reform. And then I'm going to turn to each of our 3 other panelists for a 5-minute response, and then we'll get to a wider discussion. So thank you. Over to you, Charles.
Thank you very much, Jennifer. So we're all here because we all know that social care plays a vital part in our society. It supports adults of all ages to live independent lives and in a dignified and safe way. As we're living longer, it's becoming even more important. But as we all know, it's in urgent need of reform. As a prelude to talking about the barriers, I thought it would be helpful just to remind us of some of the areas in which reform is needed. So one area is of the current means-tested system. The pandemic has obviously raised the profile of the social care system, and it's shown some of the weaknesses, but the neglect, the kind of weaknesses we've seen have actually been the result of probably decades of neglect. And it's leaving us with a system which is just about hanging together. So I want to show you a slide which illustrates the issue quite neatly, I think. So this is what has happened to health and social care spending since 2009-10. So this is indexed to 100, but just to give you some context, we spend around £2,500 per person per year on health, and we spend around £350 per year per person on social care. So 7 times as much on health. So what can we tell from this? Well, there's a couple of things. Firstly, as you can see, health spending has grown far more quickly than social care. Healthcare has been prioritised, social care hasn't. We know it's been a tough time for the NHS. We know that this decade has, but actually in social care, the growth is even lower. In fact, as you can see, which is the second issue, it's been underfunded. We are remarkably, in 2019-20, social care spending in real terms reached its level that it was at back in 2009-10. And that is obviously despite an aging population and a population in which needs has almost undoubtedly grown. In fact, adjusting for age, spending has fallen by 12%. So what does that underfunding mean? Well, it obviously does mean that there are some people now who aren't getting care, who would have got care. There is a rising burden of unmet need. It also means that providers aren't getting paid a price that allows them to deliver high quality care or to invest and innovate. The care market is precarious. Providers are handing in contracts or going out of business. And of course, delivering all this care are the workforce. They're very poorly paid, have poor conditions, turnover is high, and there are staff shortages. And that is partly the result of the fact that there isn't enough money in the system and providers aren't being paid enough. The other conclusion I would draw is that there's much excitement around the creation of integrated care systems which bring health and social care together. But really, whilst this gap and the kind of relative priority between health and social care remains, and without the funding and attention being got to social care, integration is just going to remain rhetoric, I think. But we also know that in addition to putting more investment into the social care, into the means system, there needs to be a more fundamental reform of the way that social care is needed. This chart, you will have seen, anyone who's seen Andrew Dunlop speak will have seen this chart before, but I think it's worth reminding ourselves of the issue. So this chart shows the distribution of the future care costs people at age 65 face. So you get this chart by basically ordering everyone age 65 by the future care costs they will face. On the left are those people who will face very low or no costs, and on the right are the people who will face the highest costs. This kind of picture isn't dissimilar to what you would see for healthcare in the NHS, but there's one big difference, and that is that the social care system is means tested. If you have care needs and more than £23,250, you'll get no help from the state. So this is just illustrative of the situation that someone faces. Now, this I've illustrated with this for someone with a house worth £130,000, which is that median house price in Hartlepool. So it sounds like for people living in the southeast and in London, that sounds like a low amount, a low house price. Actually, that's the median in Hartlepool, and the Hartlepool is by no means the kind of is no by means the area with the lowest house prices. So this is care costing £650 a week. So this is actually a fairly cheap residential care home. So what happens to this person? Well, let's assume that they've got income of £200 a week, £10,000 a year. That's actually probably fairly generous. There will be people with lower income than that. So they're contributing £200 a week to their care from their income. And then the rest of it, they're having to pay with their private capital. So they're carrying on doing that into week, as you can see, about 235. So almost 5 years in, at which point their capital, they've spent down, they now have £23,000, 250, at which point the state kicks in. So for this person, this is the implication of these catastrophic costs. They've basically lost everything. But more importantly, there is no way that they can plan and prepare for this. What can you do faced with this? There was some Ipsos Mori research which asked people what they were doing, and there was a group of people who were preparing financially, but the way that they were doing that was about half of them were doing it through saving. But that's not very efficient because you've got no idea about how much you would need to save. And of course, it's not only inefficient, but it's an unfair system. Someone who's wealthy but has no need for care will pay nothing, while someone in a modest house, the kind of example we've just seen here, could, with 4 or 5 years in a care home, lose everything. So what might explain the kind of lack of reform in these areas? Well, actually, I think there's different explanations for the different types. There's some overlap, but the kind of neglect and underfunding of the existing social care system. Firstly, I think there's a question of public understanding and the political weight given to social care. There is a very poor understanding of social care, what it does, who uses it, who provides it, and who pays for it. Again, from Ipsos Mori polling, they found that 47% of people think social care is free. That lack of understanding means that it doesn't really carry the political weight that the NHS has. It's also at arm's length from central government. So social care is delivered and funded by local government. But because the Treasury or central government can't really control how money put into local government is spent, or whether it is even spent on social care, there is some reluctance, I would say, at the centre to put in money, because they can't guarantee the results. They can't even guarantee that it will be spent on the things that it would like the money to be spent on. It also means that to some extent, central government can pass the buck on social care to local government. Social care also doesn't have the kind of power or leadership that the NHS has. It's fragmented, and compared to the NHS, sector leadership is weak and not highly visible. And there's often no clear sector view about what the kind of priorities are. It's obviously also a low paid sector and is seen by some as kind of a low status profession. And finally, I would say that compared to the NHS, there's a massive lack of visible performance measures around social care, showing when it's failing people. So for NHS, obviously there are waiting times, there's the 18-week standard, and there's the waiting times in A&E, but there's nothing like that for social care. Some of the factors might explain the lack of wider reform, including why a cap hasn't happened. But before handing over to the panel to talk about some of those things, I'd just like to mention some of the reasons which are cited about why reform hasn't happened. And I don't think that I'd like to put these forward, because actually I think they're probably slightly red herrings. So firstly, the lack of consensus and cross-party support. So in this area, of course, there is already reform, there is legislation on the statute books. This is the Care Act 2014, and I've underlined the relevant section here. It says that a local authority may not make a charge if the total of the cost accrued exceeds the cap on care costs. It's written in legislation. It also, the Care Act 2014, which is actually a very good piece of legislation and contains much else about social care, got cross-party support. So actually, I don't really think it's the issue in this particular case of why it hasn't happened. Secondly, cost. So reform, we have a system which targets support on really only on those people who can't afford to pay for it themselves. Any move away from that system will cost money. The government's own costings of a cap set at 72,000 for the legislation put the cost at less than £2 billion a year. That's £35 per person per year. We've done some work and estimated a more generous cap, perhaps more in line with what Andrew Dilnot proposed, which would be around 50,000 today, would cost around 3.1 billion in 2023-24. That is a week of spending on the NHS. Or if you want to put it in total economic terms, less than 1 day's worth of GDP. There's also often the issue aroused about fairness and the unfairness of who benefits. It's said that the proposals, any kind of proposal which extends support beyond the poorest would benefit the wealthier. Now, of course, if you have got a system which focuses on the poorest, any extension of that will benefit people who are not the poorest. So that's bound to be the case, but there's a more fundamental argument, which is if you did put £3 billion or whatever else into the social care system, that money has to be raised from somewhere else. You have to raise an equivalent amount of money. So to assess the overall benefits, you actually need to look at where the money's going, where it's coming from. So for example, income tax. I'm not suggesting this is the way of doing it, but if you raise it by income tax, that money would overwhelmingly come from the richest members of society. A third of income tax comes from the top 1% of taxpayers. And of course, there are other ways of raising it. You could raise it from, you could have a specific, you could raise it from older people, or you could raise it from people with a significant amount of housing wealth. There are a number of ways of raising the money. The point is that you can't really assess the overall fairness or distribution without looking at both where the benefits go and where the costs come from. So if these aren't the real reasons, what are the real blocks to reform? One might be a more kind of ideological opposition, that we are doing anything fundamental about how we pay for social care takes the welfare state into areas that hasn't been before. So it moves the system from a safety net to a more universal system. So it could be that the objections there are on matters of principle and ideology. But at this point, I'm getting out of my area of expertise. So this is where I will turn Jennifer back to you and the panel.
That's very helpful scene setter. Thank you so much, Charles. Can I just ask one question of clarification before we move to Damien? And that is, I think a lot of your comments referred to social care for people over 65. And I just wondered if you could just say a little bit more about social care costs for people under 65, given that that's quite a fast growing cost to the nation, isn't it?
Yes, so we spend around half of the total adult social care spend on people under 65. I think the issues there really are the ones around the current system and the kind of erosion of the of access and quality that's happened for older people has also really happened for that group as well. I think the issue of we don't really know very much about the lifetime costs that people, working age adults, face. There's a large group, as we probably most of us know, a large group of the people who spend money on people with learning disabilities, and they've had those from a very early age. So the issue of catastrophic care costs doesn't really affect them. I think the issue for people of working age is really about improving the current system so it provides a decent standard of care.
Yeah, thank you so much. Good. So that was a good segue into Damien. Damien, you are very long experience. You've written papers on this for the CPS and also chair the APPG on social care. Charles listed some blockages he felt that have been raised as blocking needed reform. I'd love to hear your views. Thank you.
Okay, thanks very much. And thanks, Charles, for that introduction, which was absolutely perfect in that I agreed with almost all of it until you got to your last slide, where I disagreed with quite a lot of it. So we've got a proper discussion here. Jennifer, you mentioned in the intro that you mentioned the 2017 disaster for my party when they tried to introduce a new policy during the election campaign. And similarly, the 2010 horrors for the Labour Party, the dementia tax and the death tax in order. Actually, historical delving reveals that the first Prime Minister actually to say this needed addressing urgently was Tony Blair, who made a speech to, I think, the Labour conference in '97, saying we must stop people having to sell their homes to pay for social care. So it's been with us for a quarter of a century, and as we know, other countries grasped this nettle in the '80s, and it's not a big political issue elsewhere. I think let me talk about sort of the blockages and then the process a bit. The blockages, when Charles says it's not to do with cost or with unfairness, I'm afraid it is. I mean, those are, I was responsible for this policy for some months in government. And those were two of the very big issues. I mean, he's exactly right. The CARE Act was a perfectly sensible cross-party consensus. You're right on that. You don't need a cross-party consensus for a number of reasons. One of which is that this is a government with a majority of more than 80. So it can do, it can get it through the House of Commons as long as it can get it through its own backbenchers. But the Dilnot proposals, which turned into the CARE Act, were reasonably cross-party consensual. And the problem there absolutely was cost. The Cameron, the coalition government, and then particularly the Conservative government after 2015 felt they couldn't afford it, which is why it was never actually implemented. And that's been the issue ever since. And it's interesting. Charles says it's only, if you try to be a bit more generous than went back to the sort of original Dilnot proposals, that would be at $3 billion a year. In the latest and best figures I've seen from the Health and Social Care Select Committee is talking about $7 billion a year. And of course, it's a cost that can only rise. We've all seen the demographics. So although the discussion you just had is right, that most of the increase in terms of numbers will actually come from working age adults with disabilities of one kind or another, it is still that the demographic time bomb is the extremely welcome fact that we're all living longer. And therefore, some of the key policy issues are how to get over the fact that you have an older and frailer population, which I'll come to in a second. The process, which we should talk about, is I think quite optimistic. The reason we haven't had the government's proposals yet are quite simply that the CSR, the Comprehensive Spending Review, was postponed last year. It is clearly sensible to address a long-term funding issue like this in conjunction with the CSR, which will set out the spending plans for years to come. And because that was postponed, then this was postponed as well. And obviously, because the amount of government bandwidth, particularly the Health and Social Care Department, over the past year has been 150% taken up by COVID. So I'm actually, although it is very, very easy to be cynical, given how often this can has been kicked down an ever lengthening road, that actually we will see some proposals later this year. I understand there are Treasury officials in the audience, and I also understand that one of the big roadblocks, as ever, is the Treasury. So people can look into their own souls here if they actually want us to get a solution this year. I think clearly the Treasury is going to need to sign up to something that is going to cost some money. So let's move on to the issues that need to be addressed. Obviously, funding is one. Not just the size of the funding, but very, very importantly on the issue of fairness, the mechanics of how you extract it from people. For what it's worth, I think some kind of hypothecated increase in national insurance, possibly for older people only, by which I mean 40 plus, when people have paid off student loans, might be worth considering as a way of injecting pure, if you like, state money into the system. I do think it's important not just to do it out of general taxation on working people, because that will be generationally unfair. We have got a generation of people who are moving into already in retirement, who are the homeowning generation. They have seen over the last 25 years the value of their homes go up hugely. There is something like 1.7 trillion pounds worth of free equity in homes owned by those over the age of 65. A sliver of that would actually solve this problem. So I absolutely get the point. You can't ask people to sell their homes to fund this, but you don't need to do that. If you could devise a system of some kind of insurance policy then that they could buy, then they would need only to lose a sliver of their home value. And the third point I'd make on funding is that it does seem to me that continuing to rely on local taxation is extremely foolish. I'm already talking to leaders of councils who say about 70% of their money is being spent on adult social care. You know, that's nonsense. Local government will disappear at that rate. So I think although it has to be delivered locally, it has to be funded nationally. Integration, somebody's already made the point, that's the key word from the government in terms of the Health and Social Care Act. It is very important when we get these new ICSs that the social care voice is stronger in it than I think the government's proposals are at the moment. I think there's going to need to be a lot of work on that bill, because otherwise, particularly providers who are, as Charles said, a sort of fragmented and not very loud voice, you know, their voice needs to be there as well, both third sector and private providers. We shouldn't just think of this in terms of residential care. One of the problems we've got is that we don't prevent enough people going into residential care for longer, and that actually a combination of housing and planning and building houses that people can live in for longer and using technology so that people can live as near normal a life as possible, even in really difficult circumstances like the early stages of dementia. We need to be a lot better at using that. That will keep more people in their own home for longer, which is what everyone wants. It gives them a much better quality of life, and it's cheaper for the taxpayer. This is a real double whammy that we could have that we failed to get. And the other point is that we need obviously to address the workforce. People have mentioned about how it's become a badly paid job. I mean that's true, and we need to pay people better, but also we need to provide a proper career structure. I think that working in care should be like working in the health service. There should be a proper career structure where you can feel you can spend your whole life in it and go up the ladder, and there's no sense of that at the moment, or not enough sense of that in the care system. So the more we can make it in that regard, like the NHS, the better. But I think I've now reached my 5-minute bell that Jennifer's about to bong on me. But I genuinely think this is the year. If anyone's got any ideas that nobody's thought of before, now is the time to do it, because my understanding is it is absolutely the intention of ministers actually to produce a solution sometime this year.
Thank you very much. Just on the politics and the promise that was made in July 19, I hear what you say about the spending review, but I'm still mystified as to why in the Queen's speech the language was so vague.
I mean, because the Queen's speech is about legislation, and at the moment, until they've got proposals, there isn't a bill. And indeed, it is conceivable you could do a lot of this without primary legislation. And picking up Charles's point about the 2014 Act, there is a bill on the statute book. All you need to do is press the implementation button. So, I mean, that's why it wasn't a big thing in the Queen's speech.
And you think that the politics that has built up a head of steam for something to be done this time, given that so many have promised so much in the past? And what is different this time, I guess, is what I'm trying to get at.
I think two things are different. I mean, first of all, with COVID, you know, this horrible, ghastly event that's dominated everything for the past year, one of the very few side benefits from it is that people have become much more conscious of social care. I mean, the point again Charles made that was it 47% think it's free. Well, I think people are much more knowledgeable about social care than they were 18 months ago, and so therefore they know that this is a huge and hugely important issue. And the second thing actually is the fact that you mentioned, that Boris stood on the steps of Downing Street and said this is something we're going to solve. He takes his big promises very seriously. He's very concerned about getting 20,000 police, 50,000 nurses, and so on. And social care is one of those. So he will want to do it. There will be a real drive from number 10 to get this done.
Yes, and he also said that he didn't want people to lose their houses in order to pay for care, which is quite interesting. So that's another nod towards your idea of a tax, as opposed to something related to income tax, I suppose, is what you were suggesting. Yes, or hypothecated tax is what you.
Yeah, I mean, I mean, I'm largely basing this on a German model where effectively what they've done, obviously the taxation system is different, is that they put a percentage on their equivalent of national insurance as a hypothecated tax. Now, I know the Treasury hates all hypothecation and so on, but I think in this instance, politics may triumph over economics, and I think it should. I think that would be much fairer for the reasons I explained about generational fairness. If you just take it out of income tax, then the current working age people will be paying for their own social care if they need it in 30 years' time, but they'll also be paying for their parents' generation social care. And by and large, their parents' generation is better off than they are. So that seems to me quite fundamentally unfair.
Yeah, okay, thank you very much, Damien. Let's move over to Liz. Liz, some reflections on what you've heard both from Charles and Damien.
Well, look, let me just start with where I think we are. Without doubt, the pandemic has brutally exposed some of the fundamental flaws in our system of social care that many of us have been talking about for years. And I think that is a real reason why we have to, make social care an absolute priority. If we want to build back a better country as we emerge from COVID-19, that absolutely has to be at the top of the agenda. But let me just start with something about, there's been quite a lot of things out there saying, a government's, wants to have cross-party consensus on this. Bottom line, as Damien said, government doesn't need to build cross-party consensus on this. It's got a majority of 80. And the question of this webinar, can politicians get social care done? Well, governments can, and this government has got a majority. But I do think this is an area where if you can build at least some sort of consensus, it would be important, because this is such a long-term issue. You don't want things chopping and changing over the course of a parliament. But there's been no approach to us about this. We've had several spokespeople from the government saying, one of the reasons for the delay was there was cross-party. Nothing. There's been nothing. So I just want to sort of clarify that. Because there is no cross-party discussion going on. One of the things I wanted to pick up from what Charles, I think all of the issues that Charles and Damien said about the reasons why this is problematic, why any party who puts forward a proposal, a significant proposal for reform, risks being obliterated by their opponents, as we saw with the death tax and Theresa May saw with the dementia tax. But I think there are actually some deeper issues here. One is that when the welfare state was created, the average life expectancy for men was 63. Now it's over 80, and 1 in 4 babies born today will live to be 100. But we have, across the wider welfare state, we're just not prepared for the ageing population. Secondly, I think many people, if you talk to people who work with older and disabled people, they would say that it's not as high a priority as the NHS because they don't feel valued. They don't feel a valued part of society. And I would also argue as a feminist that care is seen as women's work, not valued, not seen as that important, something that can be left to families on their own. And finally, I think it's not been a priority because nobody wants to think about what it's like being really, really old. They don't want to think about it. So, there's all the financial issues, but there's something much deeper here. And I think we ignore that at our peril, because this isn't going to happen to someone else. This isn't something we can avoid or not think about. Every single one of us will be affected either because we need care or we're going to be looking after someone. And so as a society, we have got to wake up to this fact. And that is something that politicians can lead on, a debate and discussion, but it's something that wider society, businesses, all sorts of different organizations, we can't avoid this. So let's make it a great thing, not a terrible thing. That's my first point. Second point, and I do think this bedevils this conversation. If you think about how the NHS, for many reasons, has been able to successfully argue for more money. It has professional bodies that seem to be more respected. It's one system. It has a chief executive. It has Simon Stevens, who wasn't prepared to ruffle a few feathers by asking for more money. But also, it argued for investment and reform, not more money to deliver the same, but more money to deliver better. And we don't have anywhere near enough focus of innovation and change, because we don't just want more money into a broken system that is just sort of scrimping out, 15-minute visits, up, washed, dressed and fed. We want a wholly different system. And that is something we can all play a role in arguing for innovative and new models. The prevention that we know is so important. Something I really agree with Damien here about, I believe we should have an absolute principle of home first, and we can try and use lots of technology as well as very simple things like basic home adaptations and support from voluntary and community groups to do shopping and cleaning, all of those things that help people stay at home. But we also need to look at the options between care at home and a care home. We never talk about hot housing and care. And other countries have got much more developed and different options there. So innovation is really, really important. And I would include this on the staff point, Damien, that we absolutely have to have better pay terms, in conditions and training for care workers. But if you want to make this a brilliant profession that people want to go into, why not look at new models of ownership, cooperatives, where if you work for an organisation, you own part of it. That's a great future, a great option for a career that can develop. So I think we have to have a much bigger focus on reform as being not just the investment, but the changing and innovative models, because quite frankly, if the future for social care for me, let alone my parents, is someone coming to put me to bed at 5 p.m. and I'm asked to pay a load of money for it, no, thank you. We have to have a better vision for the future. My third point is, if I'm strictly answering your question, can politicians get social care reform done? On their own, no, because you cannot get better services and support unless the users of services and their families aren't just consulted, but actually help design the support they want. This is not something professionals can deliver on their own. And again, that's a very little discussed area. Finally, nobody denies this costs, but we very, very rarely talk about the costs of not reforming, the costs for the NHS. If elderly people end up going into hospital or get stuck in hospital because they can't get the support they need in the community and at home, but also for the economy. In the century of ageing, I believe social care is as much a part of our economic infrastructure as the roads and the railways. Millions of people help care for elderly or disabled relatives. 1 in 3 family carers has to give up work or reduce their hours because they cannot get the support they need to look after their loved ones. If 1 in 3 parents left the workplace, there'd be an outcry from the parents themselves because their incomes would go, from businesses who lose their skills. And actually, Joe Biden gets this. He has made home care an absolutely central plank of his infrastructure bill because he understands in the century of aging, in a modern economy, social care is as important as, bricks and mortar. And I think that is where we have to go. I always think in politics, and believe you me, I believe there's a lot in the Labour Party, if you keep arguing the same thing, but you think if you just say it a bit louder, and shout it a bit more angrily, you'll get a different result. You're wrong. We need new arguments, positive arguments about what a brilliant care system would mean, and positive arguments about why it's right for our economy, not just a moral imperative. And if we do that and critically put users and families at the heart of this, we can get the full reform. A 10-year plan for investment in reform is what we need, and that's what we should be arguing.
Liz, just a couple of questions for you, if I might. So under Andy Burnham, Andy was talking about a national care service and having a sort of fully fledged, tax-funded system akin to the NHS. I seem to remember that was 2010. But in the last Labour manifesto, 2019, it was much more of an emphasis on the DIL not cap, which is what Charles talked about, plus free personal care a la Scotland. Does the Labour Party have a settled view at the moment about which on that spectrum that it would want?
So listen, I think a cap on costs so that people don't have to lose their life savings through catastrophic care costs is an important part of the answer, but it's not the sole solution, because a half of the users and a third of the budget for a third of the users and a half of the budget for social care is working age adults with disabilities. And that doesn't mean to say I don't think we should get agreement on that. Something is better than nothing, but it's not the whole solution. And let me just say this on a national care service. I think this means lots of different things to different people. If that means, much clearer pay terms, conditions for staff and entitlements for users, absolutely. But if that means centrally run by the NHS in Whitehall rather than those locally embedded services, I don't think that is the right approach. Because believe you me, what you really want is community services based on what people want for themselves. You cannot do that from the man or woman, although it's usually the man in Whitehall.
Right, okay, so but no settled position other than the DIL not cap is what I'm hearing in the Labour Party.
The cap is part of it, but there are a whole load of other reforms that we need too. We're prepared to play our part in making that happen. We haven't set out policy proposals yet. We're in the middle, as you know, of a policy review. But if it is just about if the question you ask is, how do you stop people having to sell their homes to pay for their care, which is what Dilna asked, you will get part of the solution, not the full solution. And I think we need much wider changes if we're going to get the quality of care and support that people need.
That's great, thank you. So we've had loads of questions. Quite a lot of them are about quality, so we'll come back to that in the discussion. So meantime, I'm going to turn to Sarah. Sarah, you've heard the two politicians here, both sounding a bit hopeful, I would say. What is your take?
Sorry, just unmuting. So I obviously come at this with the perspective of somebody who's been writing about this field for, I guess, 25 years. And in fact, I had a slightly eerie experience a few weeks ago when a colleague and I were working on a story about what might be in the Queen's speech on social care. And in the course of looking up a bit of information, I came across a story that very same colleague and I had written literally 9 years to the day earlier, which said in part, while the Queen's speech due on May the 9th will highlight the importance the government attaches to social care reform, no bill will be brought forward in the coming session of Parliament. Well, apart from the date, the speech was a couple of days later this year than it was in 2012. A rather similar sentence might have been written today. So I guess that focuses my mind on, whether there's anything in the sort of current political dynamics or social context that might encourage us to believe that this endless public policy Groundhog Day, to use your phrase, Jennifer, is finally nearing a conclusion. The underlying issue, colleagues on the panel have touched on it, which I think has scuppered reform for so long, is that the Treasury is instinctively resistant to expanding the envelope of the state and granting new entitlements, especially when this would be sunk cost that would replace money that's currently being contributed, however reluctantly or with however much difficulty, by individuals. So I understand that Boris Johnson did come very close to signing off on a version of the Dilnot reforms last March before the full extent of COVID was evident. And then again that he was leaning heavily towards this last September, but on each occasion the Treasury demurred, talking about the uncertainties of the post-COVID fiscal environment. But cost isn't the only obstacle, as I think we all agree. And I wonder if in some ways the political context has actually become a little more challenging. The Johnson government's commitment to levelling up has allowed the Treasury to raise legitimate concerns about implementing a cap which would in effect redistribute capital to people who are not rich but are sufficiently comfortably off that they don't qualify for means-tested help. I know Charles said that's kind of inevitable in a system that currently offers no help to anybody outside a very narrow band, but it still is, I think, politically sensitive in the current climate. The other issue that I think has bedeviled attempts to reform social care for so many years is this framing of the problem as being fundamentally about the need to protect people's homes so they can pass that inheritance on to their children. Not only does this obviously skew the shape of any reform, but it also ignores the fact that, despite the tendency of the media, and I would most certainly not exempt the FT from this, to illustrate articles about social care with a gnarled hand on a walking stick, the majority, well, I think it's just about the majority, certainly, very close to half of social care spending, as we've already touched on in this session, goes on working age adults. And in most cases, people who fall into that category probably won't have a home to protect. I think the COVID crisis has also made even more sensitive issues of intergenerational fairness. I think Damien touched on this, but it does make it arguably harder to get public buy-in for any funding reform which involved younger people paying more tax to support what they would doubtless already see as a feather-bedded older generation or two. So has anything changed in the last few months which could heighten the political imperative for action? Colleagues have already touched on this, but I absolutely agree that one thing that the pandemic achieved was to humanize the crisis in the sector. I think Liz was talking about this. I think we all became aware of just how much social care is the Cinderella service to the NHS. We saw vulnerable people being decanted from hospitals into care homes. And you don't have to believe that the NHS knowingly sent people with COVID into residential care to recognise that protecting hospitals took precedence over everything. And you could see it again in the priority that hospitals received for PPE and testing, at least certainly in the early part of the pandemic. I think things did undoubtedly improve later. But perhaps the biggest reason of all for having more optimism that some reform will be agreed, however narrowly drawn it may be, is that there will be a clear and real political price to be paid if the government doesn't now deliver on Johnson's absolutely unqualified pledge to fix the system. Damien said Boris Johnson is a man who is very focused on delivering on those manifesto commitments. He wants to go to the electorate in 2023, 2024, being able to say that he has ticked off every one of those commitments. So I think that's probably the strongest argument actually for believing it will happen. And if it doesn't, opposition MPs such as Liz are going to be harrying the government at every turn over the next 3 years, wanting an explanation as to why it hasn't happened. So yes, a little optimism, but largely for reasons of the sort of political realities, I think.
Much, Sarah. Sarah, as you speak, I'm just looking at the piece that you wrote, and I think you referred to about your discussion on the Queen's Speech, your piece in the FT with Chris Giles and George Parker. And in that, you seem to be thinking, or at least your briefing from insiders seemed to think that a social care tax was being considered alongside the Dilnot model, which implies, I think, that would that may not be relating directly to a direct wealth sort of asset tax of housing wealth, but something more akin to what Damien was suggesting.
Absolutely. I think that the need to protect housing wealth, which is itself, as Damien mentioned, a clear, or I think you mentioned actually, a clear manifesto commitment, means some other form of funding will need to be found. And I guess, as you said, the Treasury doesn't like hypothecated taxation, but I get the feeling that the mood is slightly softening on that. And we do have a template, I suppose. If you look back to, I think it was the early 2000s, wasn't it, when Gordon Brown did the 1 penny on national insurance for the NHS? And I think by and large that was relatively popular with the electorate.
Yes, that was after the Oneness Review, wasn't it? And it was in different economic circumstances as well.
It was in very different economic circumstances. No, that is very true.
Indeed.
Yes, I'm not saying at all this would be easy to sell, but it may be what they look at. Yeah.
Indeed, Sarah. And also one thing that you mentioned, I was just going to turn to Charles for a bit of clarification, because Sarah, you did mention about linking this to levelling up, and you did also imply that that sort of taking money out of houses might be quite regressive. But I know, Charles, you've done some recent analysis, which you might want to talk about, which shows that it's not so regressive as you think.
Oh.
Well, I think, Jennifer, I think I'm sure Sarah and I agree. I mean, I think Sarah is also talking about some of the politics around this, because, you can obviously design a system which takes the money from those people who would benefit from it, and you're just in effect pooling the risks. But presentationally, I think that is true, to be seen to be giving money to wealthy homeowners, which inevitably some of the benefits will go to those people, is like a risk. But I also think, of course, if we also invested and increased funding in the means tested system, which actually the need for funding there is a larger amount. When you look at that gap that I talked about, that of course would go to people who are poorer. And so actually, I think that all points to, for several reasons, we need a package of reforms which covers all those things. It covers quality and access of the current system, but also extends risk pooling.
Thank you. And while I begin to look at your questions, people who are watching, I don't know if anyone knows the answer to the circumstances in which Germany was able to politically argue for this social insurance tax that they set up. It must have been now 20 years ago, wasn't it? Damien, do you know the answer to that?
I don't know the full answer, but in talking to German politicians, they say that essentially they were incredibly nervous. I mean, all the things Sarah's just been talking about, the thought of inventing a new tax or hypothecating money, they thought it was going to be hugely controversial, and it sort of wasn't. And it's now an accepted part of the system, and indeed they've had to keep the system secure, because they're suffering all the same demographic pressures. They've increased the amount hypothecated, the percentage hypothecated in the course of the last 20 years or so. And again, it caused barely a ripple in terms of wider German politics. So I hold that out as a sort of hope at the end of all this, that actually, if you do find a system that puts the whole care system on a stable footing, then actually you can do tweaks to that over the decades that aren't too politically controversial.
Yes, and of course they're a lot more used in Germany, aren't they, to social insurance as a model for providing welfare. Liz, do you know any more about the German system?
No, I mean, I was just saying that, I am all for learning from other countries, and particularly in new models of delivery, whether it's mixing housing and care and so on. But they have a much stronger social partnership model in Germany, between employers and employees, a much more federated, local. And so whilst we need to look at those options, you can't just, take one system, this, you do all this. But what I would say here is, this issue about the right balance here, I think everybody here would probably agree. You can't leave this up to markets and individuals alone. You need to pool your resources and share your risk. Absolutely. But there's a really important issue here between balance across the incomes, with the broadest shoulders, are carrying the biggest burden, but also across the generations, because the older population has paid the health price of COVID, and the working age population is borne the economic costs. My point would be, there's too often, I think, a little bit of the sort of clash of the generations language. If I think about the Kendall family, touch wood, mum and dad are okay. But me and my brother would be, terribly worried what would happen, how would we cope? But they are as worried about my brother and how's he going to pay the mortgage and do the childcare with the kids. In families, you try and help each other. And I think if we do too much of this, there's older people over here and younger people over there, we forget that's not how people live their lives. So the real issue, though, is what people don't want to do is pay a lot extra, not knowing what they're going to get for it.
Mm-hmm.
Rubbish system. They don't want that, or it'll be frittered away on something else. So I do think this being very clear where the money is coming from and that it will be for social care is really important.
Right, that's a good way to link to some of the questions here. So just assume that Damien is right. We have a solution, some kind of solution later on in the year in the spending review. And that solution is, say, a DIL-NOT cap of some sort and some more investment in social care to improve access and quality. Then let's get on to the quality question then. How do you, linking to what you said, Liz, how do you make sure that, given that this is a local service, it's through local authority funding, how do you make sure that those funds get into social care if the money is routed through the route it is at the moment? That's the first question, and then we'll get on to social care provision in a minute. So who'd like to have a go at that? Sarah, do you want to?
Yes, I guess the sort of one way around that would be to have some kind of central sort of standard setting entity that would be looking at standards across this incredibly deeply fragmented, largely private sector market. And of course, that could perhaps be a role for the Department of Health and Social Care, which since it added those last three words about 3 years ago, hasn't really stepped forward to do anything sort of meaningful to actually enhance the quality of care. Could there be a role for the department in doing that? Because this, I think, is what Nicola Sturgeon is talking about with the proposal that the SNP has put forward for the National Care Service, that it would include, a sort of centrally set standard setting body. So I think that could be one way around it, because I do think, as somebody mentioned earlier, there's a huge problem about the lack of data we have, on not only sort of performance yardsticks, but also data on outcomes of care in, either in community care in the NHS or in the care home sector. And understandably, the Treasury is reluctant to invest when they can't see, they have no way of divining the outcomes and measuring the outcomes. So I think that's a quite an important issue.
Yeah. Damien, how would you make sure local government spent the money in the way intended?
I agree. It's provision of information, so you've actually got national standards that you can look to, and proper inspection and enforcement. I have to say would be quite sceptical about putting that inside the department, because in the end the department defends its own interests. All departments do, and I much prefer to see it in the CQC. Frankly, I mean, the CQC has grown over the past few years to becoming more like Ofsted, where it's a big player in the sector, in the health sector, and I would like to see that extended fully to the social care sector. And as a mischievous thought, one of the reasons why I was doing social care policy as First Secretary of State was that it struck me that it takes in so many departments. It's not just the health department. You require the local government and planning department and various other departments to play along to get the kind of holistic solution we're all looking for. And therefore that needs to be driven from the centre. And taking the point that for the 3 years it was put in the Department of Health after I was sacked from government, and we've had 3 years where the department has been departmental about it. I think it does need to be driven from the centre, and that's why I'm encouraged now that this policy is partly being run from the department, but also partly being run from number 10, because that's the way something will actually happen.
Yeah, I mean, the CQC currently regulate providers, don't they, of social care, both private and non-private. But they also, isn't there something in the air about them looking at the commissioning of social care as well by local government? So that's another. So do you think that that's enough? There is a bigger role there needed, essentially, in addition to the CQC?
I think if you try to put another central body in, that would be complicated. You've got the CQC there, and yes, the Health and Social Care Bill does propose to extend their responsibilities. It will become a very big and very important player in this role, and in a sense, it's probably slightly unknown. If you, talk to any parent, any teacher, and Ofsted features very, very big in their lives. The CQC hasn't quite got there yet, but that was Jeremy Hunt's vision of it, and I think that's the sort of game in town. That's what needs to happen, rather than create yet another central body that will sort of cut across it. I think setting standards and enforcing them, that makes you quite powerful, and therefore, if you do it well, very effective.
Yes, there is a question, isn't there, about whether a central regulator is the improvement body or whether it's inspecting against risk. And there is a question in other local government services where there's no CQC, whether the peer-to-peer learning that they have is enough to improve services. So I don't know, Liz, whether you or Charles.
So
indeed.
I mean, I remember for my sins going through the first Lansley reforms, both set of whatever it ended up, both sets of 6 or 8 weeks of my life, making the point that there wasn't anything here on the social care commissioning side and all of that. So I'm sure that will be, it's good that will be sorted out. But let me just come back to this point that we never talk about, which is about users and families, that they really are not involved and driving this. And the people who know best often about the quality of care, the efficiency, whether it's joined up. I mean, I often make this point, the people who know best how to join up their services are the people who use them, because they don't have a health need over here, a social care need here. The people who absolutely drive a focus towards prevention are the people who use services, because they don't want to see their needs left for months and months and months on end getting worse. And the people who are the toughest critics on waste and inefficiency are users and families, because they just see pointless hundreds of conversations with people. So I would much rather we had a lot more focus on how is every single local authority and NHS organisation going to not just consult users and families, but really put them in the driving seat. I mean, there have been some innovations, the personal budgets, direct payments, but I would much rather more of our focus and attention went on that, because we'll get the regulation right. But if regulation and national bodies, and I would say structural reorganisation of the NHS was the key to improving quality and outcomes, we'd have died and gone to heaven, because we'd had 20 of these reorganisations in the last 20 years or whatever it is. So I'm not saying it doesn't play a role. I do know that and I understand it, but we never put as much attention and focus on genuinely giving users and families a say. And ultimately, I think that is a major point that drives quality improvement.
Yeah. Now, we haven't really mentioned that very much about domiciliary care, but most of us will probably use that over and above residential care, won't we? And I wondered whether your comments about the quality of care relate just as much to domiciliary care than they do to care homes and residential.
Absolutely, far more. people actually use dom care than residential care. We haven't even mentioned personal assistance employed by people through direct payments, which I think is a growing area for working age adults with disabilities. But we also have to look at that in conjunction with what I would call prevention, which is the sort of shopping, cleaning, talking to people who've got loneliness, trying to keep them well at home, which are not which don't cost the world, but can't be done on the cheap.
Yeah.
And it's very interesting if you look at somewhere like Scotland, where since free personal care has been introduced, the preventive side has all but disappeared from the system. So we've got to really think about all of these things together, because there is a massive chunk missing from the system that isn't even on the agenda, as well as too much of a focus thing,
Yeah,
I think, being
really,
on res care.
a really important point. And Damien, I wonder whether APPG has been very active in looking at this rather healthy aging, or at least the supportive care which would prevent the downstream deterioration. And Sarah, I wondered whether you and yours at the FT, I know you do quite a lot of work on technology and looking at how that might be used in this kind of social care setting. So Damien first, the kind of the future side, the positive side of how we're all going to be more independent later on.
I mean, it is one of those really frustrating areas because there are so many good ideas in this, all of which are simple.
Yeah.
I'm not talking about using cutting edge technology particularly. I mean, to give one example, somebody, a real person who gets care gave me, they are basically bedridden, and somebody does their shopping for them. It's a perfectly normal situation. For most of us, Alexa is a toy that we might have in the corner of the room. It's an absolute lifesaver for her. In that she says when she's forgotten something, then her Alexa can phone up her shopper who is going around the supermarket and say, buy chocolate biscuits or whatever. And it's that kind of ordinary day-to-day stuff where technology can make a difference. And more widely in housing, there is something like 10 times the proportion of houses built suitable for frail people, if I put it that way, in America, in Australia, in New Zealand, than we do in this country. And I've argued in various of the papers you mentioned that we need a separate use class in the planning system. Just as you plan for first-time buyers, frankly, we should plan either all age houses and/or sort of last-time buyers, as it were. And one of the providers put to me, what you need is that your last house should be in some ways your best house. It certainly won't be your biggest house because you don't need all that space and you might need it to be on one level and all that kind of thing. But you can not only put in all the safety features, but actually spend the money that you've released from the equity, the big family house that we all want sold on because that will help people further down the age chain. But actually spend that money on top of the range stuff so that you can feel proud of it. You're not just moving into, as it were, an old person's, slightly shabby place, but actually, in some ways, the best cookie you've ever had and things like that. So there's there are ideas bubbling under, but they've not been adopted, frankly, by successive governments and the public sector generally. And there is a huge opportunity here.
Yeah. Sorry, just before I just go to Sarah, do you see any link, Damien, with what you've just said and the levelling up strategy?
Yes, I mean, absolutely. I think levelling up needs to apply to health and social care as much as it does to the areas we normally think about. And so far, we barely scratched the surface of that. And since you've mentioned levelling up, one last thing before I shut up is that one of the problems of, if you like, a simple deal not solution where you just establish a national level is that if you made it £50,000, and you said, okay, I'm in for £50,000 of my money somehow. If you own a £2 million house in a London suburb, then okay, whatever, the kids can cope with that. If you own a £130,000 house in Hartlepool, then that's a significant chunk gone. So if you just do it like that, then you have levelling up consequences, which is why I think there probably ought to be tweaks in that, and it might be a percentage of your total wealth or something that you might want to give up.
Thank you. Charles, has that kind of thing been modelled, that more differential approach to the cap?
I mean, those things I think have been floated before. I think we probably, as part of the Dilmont Commission, we probably did look at some of those things. There are definitely choices around that. There is no one model. I definitely think they are. Can I just come in, Jennifer, on the point about innovation and investment?
Yeah.
Because I think there are, we have to also remember that quite a lot of this market is, most of it's private sector, they are private providers, and a large part of it is private payers. And I do think, Damien mentioned some of the regulatory barriers, and which may be, normally you'd expect in a market like that, a private market with private payers would develop these kind of solutions. Why isn't it? And maybe it also points us towards wider market failures. Maybe this isn't a very well functioning market. Maybe there is the kind of, we know that often purchases of care are distressed purchases. Do people have enough time and how to make those kind of intelligent purchases, to look at all those kind of things? And does that inhibit the development of a kind of innovative market? I think there are some complex things going on here.
Thank you. And Sarah, sorry, I was going to turn to you about the technology side and whether you've seen things that you would like to put forwards here that we should be thinking about, or at least the government should.
Well, I'm actually thinking of a very low-tech project I visited in Cornwall a few years ago, which really did seem to have found a recipe for improving quality of life for elderly people receiving care at home. The NHS worked with Age UK, and the whole sort of ethos was to ask people not, what's the matter with you, but what matters to you. And the people I spoke with there told me that, they talked to this elderly gentleman and he'd said, the one thing I care about is getting down to the beach to see my dog running on the sands. And an elderly lady said, my dearest wish is to visit a new branch of Sainsbury's, which had just opened in the town. And through a sort of army of volunteers, they kind of reconceived the notion of caring for elderly people. Now, it was obviously a sort of scheme that might be hard to replicate outside Cornwall, which has a large number of healthy retirees who could form the sort of backbone of this army of volunteers. But it was a very moving and interesting, and I think not at all expensive approach. On technology more generally, I think there is still an enormous way to go. I was looking at some data the other day. Apparently, a third of care homes are not even digitized. They're doing everything on paper still.
Yeah.
So an enormous way to go. But I do know that NHSX, because I was talking to the people there quite recently, that they are very focused on, really getting the advantages of technology for the care home sector. And they're sort of aware that there is a journey to be gone on, as it were, there, which hasn't yet, of course, gone far enough.
Yes, and there's of course a new data strategy, at least I think, isn't there, which is planned, which includes social care and looking and boosting the architecture on data, so that at least we can get a closer handle on some of the quality elements that one can measure through this.
Totally, yes.
Yes. So this has gone very fast. We've really scratched the surface. We're right out of time now, but I think I don't know about you, everyone who's listening. I feel quite hopeful on this. It feels to me that we may have some movement later on this year to do with the spending review. At least it will be the DILNOT cap. It may be some more on top of that. There's obviously worry about taxing people's housing assets, but then there may be other options to do with more hypothecation, which seem to be at least aired by Damien. And so I think that hopefully there'll be some movement, but I think the big question then becomes how far access is expanded, and the quality question I think still is on the table, but a lot to play for. And as Liz says, it's a positive agenda. This is something that we can really work on, and it's very important for the future of Britain, isn't it? So there we must leave it. A big thanks to all our panelists today, a big thanks to all of you watching and for all of your questions, which I came to only a few of those. You can watch this online later if you want, and share with anyone who missed it. A couple more things, really. First thing, this Thursday, we're publishing a report on how did the government do in supporting social care in the pandemic and what that means for reform. Look out for it, please. That's Thursday. Our next webinar is going to be all you need to know on tech and the NHS in recovery from the pandemic. You can register and on our website now and in the chat function. and more on social care. There'll be more coming from us later this year, the annual Real Centre lecture in the autumn on social care. So you can sign up to that on our website as well. So with all that in mind, thank you very much to all our panelists for taking the time today on this vexed question. I think we made some progress. Very, very grateful, and see you all again, and many thanks. Take care.